President Obama. My name is Robin Harned, and my topic is on how to pay for universal health care. How are you going to force the drug dealers in your town to buy health insurance? How are you going to force the illegal aliens to buy health insurance? You're probably not. If an illegal alien gets hit by a car or a drug dealer gets shot, they'll still be transported to the hospital because, out of humanity, we'll still treat them. Therefore, those of us who can pay for our health coverage will continue to pay for those who can't or those who choose not to. There's only one way to ensure that every human being living in the United States equally pays for their health insurance coverage, and that is to tax food. If we place a 9% health care tax at the grocery store, in restaurants, each and every person will equally pay for their health care one bite at a time. Here's the math. There's approximately 312 million people that live in the United States. If the average person eats an average of $10 a day, which includes eating at home, eating in restaurants, if you're in the hospital, you're eating something, if you live in a nursing home, you're eating something, and you tax that number by 9%, you come out with $280 million collected each day. Now, if you multiply that number times 365 days in a year, the grand total of taxes collected each year is over $102 billion. The $102 billion collected each year should cover the estimated $940 billion you predicted that your new plan would cost over the next 10 years, and every single person will now equally pay for their health insurance. Now, I know you're saying to yourself that some people can't afford to pay more taxes. Well, guess what? Those are the same people that have no problems affording beer, cigarettes, and lottery tickets. $9 more per 100 spent on food and drinks won't make or break anyone. That's just one pack of cigarettes, a beer, and a lottery ticket. Lower income families already on food stamps will also have to pay for their health care tax at the grocery store. The amount of food stamps they're eligible for should be adjusted according to their income when they apply for assistance to make up for the difference in their health care tax. In other words, we're not going to give them more food stamps to make up for their health care tax. We're going to lower their food stamps by 9% to stay fair across the board. Companies that offer health care tax to their employees can still continue to do so, and the government could reimburse them proportionately or lower their business taxes to compensate for the difference. We can also encourage people to eat healthy by having a lower tax on broccoli and bananas and a higher tax on chips, fast food, sodas, and alcohol. If you eat or drink it, it will be taxed. So from the time you're born until the time you die, you're eating something. Babies eat formula. People on life support eat through IVs. Everyone from Billy Bob down the street to even you, Mr. President, will equally pay for their health care tax. So now, Mr. President, you can see how easy it is to equally pay for health insurance. Thanks for listening, and thanks for your attempt at universal health care.